See, they try and block this stream. 22nd of the 2nd, 2019. What's the point of sending anything in the post in the United Kingdom when there's a breach of contract? This is people's rights in the United Kingdom to opt out on data sharing. And I have a proof of posting. This is going back now. Reference to NHS Digital Company Limited, Leeds head office in United Kingdom. To the managing director. One of them is originally the data controller of your own medical data. This is like a receipt. I won't show it all because it's got some handwritten on it. Well, I double checked today. State it's got returned to sender, refused to sign for it, and it cost X amount to post it. And I'm gonna, one of the medical companies who have a contract with, now they're using everything digital, everything is online, and the concern, I'll go to this document, which since I found out, this is when I opted out. I did in 2010, and ever since then it's just been one of these situations. So this was to give notice to regarding my medical records and the records for which whom is responsible and for one's direct medical care. So I do not consent and refuse for my records for any purpose other than my personal offer and choice. And it's just Constitution, United Kingdom still exists, although they won't tell you that. Make sure that my dissent is recorded by whatever means possible, and the codes, I'm going to show you how they use that and how they outsource to a new medical company. This is like, I found this out last year. Well, it's like a digital company, and this is why they don't use email that my mate put in for me on the letters, and they took an effort to type them up, and I can no longer do that, nor can they. So this is why I don't get any offer of lawful full disclosure of goods and services anymore. And this is since May the national 2018, and how they use statutory law, the data protection regulations. Well, I want to know what the hell's going on. Anyway, this is, if you can see this in the daylight, the GP, General Medical Council, they have to be a medical, and we have to hold them accountable. They work for the public purse and public funds, and the public have a right to know. So this is what they use as patient identifiable data code, and it hasn't changed. And then also the national NHS Digital Limited company it is. So it's a CEO's a private. He's got shares from two American private companies. It's all privatisation again, more. So this is where I already opted out in 2010, and I got a letter confirming I already opted out. So I just wanted to make sure, and that's why I found this website. And this was printed out for me, and the code that NHS Digital uses, the secondary one down the bottom. If you're not bothered about anyone out there, then you just fill the second one in, the bottom box where you consent. But I limit access to my private life data. So if you didn't realise that by the year you have the option and you have the right to opt out, and it does not affect your offer of health and social care, whether national so-called public services and bodies, if you want to call them that. The data controller is the NHS Service across England, are required to supply individuals' personal and confidential medical information to be part of the Department of Health, the Health and Social Care Information Centre, known as NHS Digital CCG, Conditional Commission, out of hours, call centres, 111 numbers, and a computer system. Do you really want all your private information? Well, it's not all going to be accessed anyway, these doing the way it is now. But anyway, at least you put your information in writing. I did this 2010, and thank goodness I did. Because there's from the 25th of May 2018, so it's new data protection. Statutory law. So that's what I found out by a particular website, and opting out does not affect your R, which is for the purpose of your direct care. The admins in my offer in my area, they have partners, men and women. I don't know how many now, but how many admins they got behind the scenes. And the last time I sought clarification, struggling to talk on the phone, what's going on with all these offer referrals? So this document was dated Tuesday, the 14th of April. Now it's it shows the next bit who, so I'm going to show you that. Check it out for yourself. It's medconfidential.org and how to enable the NHS data sharing info to get independent viewpoint if you want. It's not independent, by the way. This particular website is much better. So I'll go on to how the national in United Kingdom data opt-out covers data leaving NHS digital computer systems. So cancel register before October 2018. Other diseases register dates undecided and CPRD by the year, and this is important, 2020, hospitals and other care providers will have access to your data. They've not for great absences or constantly denying access to various services, constantly closing their offices from their businesses. Write down we'll make another attempt next week. And then because you're not aware how to conditional accept an offer contract and require the full disclosure, and then because the delays are posted not getting there or lost whatever, you do an email or a letter by email attachment, my friend does it for me, gets completely disregarded. But then yesterday I found out it's not just me, there's others who are getting the merry-go-round. So there's an agenda, a bigger picture for those that are very poorly, disabled people, the elderly, and expect you to be able to, there's a such a presumption being made. That individuals in certain circumstances automatically have friends and family to help them out with things. And be aware how the data can be misused if you don't rebut things that are not held correctly about you. This is why I've been trying to get my data, because I know things that haven't been held correctly and factual. And I've already done rebuttals before and held certain individuals accountable in their job role. So whether you're dealing with private corporations, limited companies, or public, and if you can hear that, be aware of this targeting unlawfully and singling out people. You've done nothing wrong unlawfully. It's others that are hiding behind agendas for profit making out of your private data. Yeah, so that does have some massive consequences if, God forbid, you end up in an emergency situation. I hope you don't. You end up in the state system or a hospital setting. They could easily make something up and misunderstand, misconstrue some information held on a computer system. And don't even get me started how the DWP could easily try and twist things and say, oh, you're not really that ill, or you don't have that condition or that disability, and discriminate against you. I'm not scaremongering. You need to be prepared and have the armour on, invisible armour, so to speak, of information to protect your right to your personal data, and that's widespread. So it's not just the National Health Service that used to be known, what it used to be effective. Now it's selling it off already to the highest bidder, and it's profitable, our data. So be careful what you do online, because all these cookies, all that data can also be shared. Who knows? I see people posting all sorts of personal things and images of all sorts. It's up to each and one. It's up to the individual what they want to do. But be aware where that data may end up. God bless. Keep safe. Be aware. Just sharing some information that might help somebody else as well. That's all I have to say for now.